Hello, how are you? I hope you're doing well. Congratulations, because if you are watching this video, that means you are going through strenuous studying, education to become a healthcare provider. Whether it be PA student, nursing student, medical student, physical therapy student, all kinds of healthcare workers. Congratulations. So I'm gonna try, this is my first video on this congenital heart diseases. I am not Ninja Nerd. I'm not Najib Medical Lectures. I'm not clinical med ed. I'm just Facundo, an emergency doctor in New York. And if you're new and you like it, subscribe. I don't know where I'm gonna put this subscribe thing, like somewhere here. Subscribe to the channel. So without further ado, congenital heart defects. It's a quick, short, but I think it's just helpful things that you might need when you're studying these things. So we're going to go on this side first. We have blue babies, the 5 T's. You probably heard that. Blue baby, cyanotic baby, early cyanosis. And look what I'm going to do with early. Early. R comes before L. So this is a right to left shunt, right to left shunting, okay? And to remember the 5 T's, I actually go in order. I do 1, 2, 3, 4, 5. As simple as that. If you can count, you got this. So one thing, a trunk, a tree trunk. 1, truncus arteriosus, truncus arteriosus. 2 things, 2 big things in the heart, 2 great things, aorta and pulmonary artery. Transposition of the great vessels, the 2 great vessels. 2, 3 things, tres, tricuspid atresia. 4, easy, 1, 2, 3, 4. 4 things, the trilogy of Fallot. And 5 words, 5 things, and 5 is just sounds big, complicated, and it is. I never remember this. Total anomalous pulmonary venous return. Okay, there you go. Early, right to left, shunting, blue baby, 5 T's, 1, 2, 3, 4, 5. There you go. I'll mention a little extra of the trilogy of Fallot. This is how I remember stuff. Is boot shape in the heart. Boot shape on the x-ray. It's going to look like a boot. And then you have the mnemonic proof. That's how I like to mention it, just proof, which are the 4 defects. Pulmonary stenosis, right ventricular hypertrophy, overriding aorta is actually overriding on top of the ventral septal defect. Okay? And I put this one on top and first because pulmonary stenosis is what determines the severity of the disease and the prognosis. So the more severe this is, the worse the outcome. Okay? Nice. Now the other side. Hopefully you staying with me. I'm trying to make this to the point. Acyanotic baby. No cyanosis. Later in life, because later in life you may have reversal of the shunt leading to Eisenmenger syndrome. But look at this, later. LR, left to right shunt. Okay? Easy peasy. Most common, number 1, BSD, ventral septal defect. Number 2, patent ductus arteriosus. And number 3, ASD, atrial septal defect. So I drew a little guy here to the best of my abilities. Okay? And this is where you would auscultate the heart, you know? APTM. In Spanish, if you're Spanish, if you happen to speak Spanish, apretame, apretame. So apretame. There you go. Aortic, pulmonic, tricuspid, mitral. All right? And yes, sometimes if you get technical, there's 2 areas of the tricuspid, left sternal border. But every time you hear left sternal border, they're mainly referring to tricuspid area, okay? So how are these things going to sound and where are you going to hear them? I'm covering this because these are high yield topics that they like to test on exams, okay? So we're going to go. Hope the beat is coming out fine. 1, 2, 3. Did I do it right? No. It's 1, 2, 3. All right, just like that. 1, 2, 3. 1, 2, 3. So 2 is going to be PDA. It's going to be a continuous machine-like murmur. Continuous murmur. And you're going to hear it in the left upper chest. In this area, they might even say behind the scapula, in between the scapula, left upper chest, this whole area. Next, we have BSD and ASD, 1 and 3, tricuspid area. And for BSD, it's a blowing, harsh, systolic murmur. Systolic makes sense because during systole, ventricles contract, and at that time, the blood is being pushed through the defect, causing a sound. So, blowing, harsh, hollow systolic murmur during the whole systole period. You're going to have BSD, so in case they try to trick you. Then, ASD, atrial contraction. So, diastolic murmur, and this one I will write. And this is the one that they like to say, fixed, wide, split, S2. If you hear that, there's, as far as I know, after, I don't know, 4 or 5, like 5, 6 years of medicine, there's nothing that does this aside from ASD. So if you see ASD, that's it. They go together. Don't overthink it. That's it. If you see left sternal border, tricuspid, your mind goes to that side. And if you're talking about kid, baby, BSD. Blowing, harsh, hollow systolic murmur. That's about it. That's about it. I don't even know how long this video is. But I hope these quick tips and helpful study tips helped you. Mnemonics, little visual things helped you. Please let me know in the comments what you think. If you liked it, if you want any other topics you want me to cover, I'll go through it. I'll see which one is most requested and I'll do it, okay? Right now it's like 5 p.m. I've been in the hospital since 7 a.m. But I'm happy I get to do this. Someone will benefit from it. That's why I do these videos. Pleasure, subscribe, like, bell, whatever people do on YouTube. Thank you so much. Adios.